So eating disorders have the highest mortality rate of all mental health illnesses. That surprised me. And there are three main focus or indicators, I should say, areas that may indicate somebody is heading towards an eating disorder. And it includes changes in behaviors around food and eating. So they become like real ritualistic, like, or they all of a sudden, I'm a vegan, I don't eat this, I don't eat that. They have certain rules, like I don't eat past 5 o'clock. I no longer eat meat. I don't use ketchup. I mean, just all these weird, quirky things. And it can almost seem like they eat in secrecy. They have obsessions, like they count calories. They try to calculate how many calories they burnt doing exercise and can only eat that amount of calories. Um, they are fixated on their weight, body shape, and size. And then what may end up happening because this obsession with food is that they have changes in their functionality, like their social life. They become socially withdrawn. They may lose their job because they're so obsessed they can't keep up with the work. And they may develop physical illnesses and low self-esteem. Some of the warning signs related to eating disorders include lying about eating, like either saying, I already ate before I came, like if you come to a party, or you might say, like, I don't eat that anymore. And you might also eat in secret. Um, you might have secret athletic training. When I was an athlete, some of the women on the team used to like wake up in the middle of the night and do secret running, right, to burn off more calories. Or they would do something where like their coach told them to run 5 miles. And so in their mind, what they did is they ran a 3 mile warm up and then did 5 miles. So they were adding more miles onto their mileage, if that makes sense. Excessive training, so training over and above what you need to prepare for a race. And then obsessed with weight, so they weighing themselves multiple times a day after they eat, after they poop, after they you know um, run. So before and after running, and then of course the fear of being fat. The three main types of eating disorders include anorexia nervosa. If I forget to say the nervosa, I'm sorry during this lecture, but it's important that you distinguish between anorexia and anorexia nervosa because your patient may have anorexia as a symptom of their disease, but anorexia nervosa refers to starving oneself, self-induced starving. And then people with anorexia can be less than 50% of their expected normal weight. They can end up looking like a skeleton. Even when they're not eating, they are preoccupied with food. They read, food labels. They know the caloric content of every type of food. Um, and they might crave food and make food and cook food, but then give it all away. Okay? Then with bulimia nervosa, these are the people that binge and purge. So they eat excessive amounts of food, so they binge. They feel guilty about it and feel emotionally out of control. So the binge is followed by purging. So this is compensatory behaviors to prevent weight gain, such as self-induced vomiting, laxative misuse, and diuretic misuse, and also massive excessive exercise. They can do that as well. And there's a lot of health consequences with that, especially you can get a low potassium for self-induced vomiting, which, as you know, can cause cardiac problems. And then the other condition is called binge eating disorder. And this is repeated rapid consumption of large amounts of food unrelated to hunger. People at risk for eating disorders include people that work in professions that really stress being thin and being perfect, like athletes, models, gymnasts, dancers. It could also be related to family dynamics or genetics, like if somebody in your family had an eating disorder, you may have an eating disorder. You may have a mother who, wants you to look perfect and it's always commenting on your weight. That could be a factor. And the culture. I remember when my daughter was like in 8th grade, she told me about an Instagram page that was called Ano Inspo. In other words, inspiration to be anorexic. And it was giving tips about how to be anorexic. Thank God she wasn't anorexic, but, if it's part of your culture, in being perfect, that may be a risk factor. Somebody with a history of obesity, sometimes they lose weight and then they, you know, go the opposite way. Um, or they may have binge eating disorder. And then, of course, psychological factors. There are some overlap, like, for example, people with anxiety, depression, and substance abuse may have that could be a risk factor for eating disorders. And then people with like obsessive compulsive disorder or avoidant personality disorder or borderline may also have eating disorders. At-risk population include females, the transgender population, and veterans having an uptick in eating disorders as well. Some of the cues for anorexia can be remembered with the mnemonic anorexia. So A stands for amenorrhea. People that have anorexia nervosa, women, obviously, um, the body shuts down when it doesn't get enough food. It thinks, boy, I can't reproduce right now. So they get amenorrhea. They no longer have periods. N stands for there's no other reason for the weight loss, right? They don't have a disease that's causing anorexia, and they don't have something that's increasing their metabolism, a disease anyway. O is for obviously they're thin, but they feel fat. R is they refuse to maintain a normal weight, and they think that their weight that they are maintaining is too high. E stands for epigastric discomfort. X stands for extra peculiar symptoms, like they start to grow downy hair all over their body called luengo, and that's like when a baby's born, they have that little baby hair all over their body to keep them warm because they're hypothermic. I is intense fear of getting fat, and A is always thinking about food. They're obsessed with food, calories, their weight. It can really create social withdrawal. When recognizing cues of anorexia, think they have malnutrition. They're not getting enough nutrients, so everything is low, right? Low vital signs, low temperature, hypothermia, low heart rate, which means bradycardia, low blood pressure. They're going to have peripheral edema. The reason for peripheral edema is that when you have malnutrition, they're going to have a low albumin low albumin. Albumin keeps fluid within the vascular system. So if you have a low albumin, you're going to have peripheral edema. Okay? Dry, brittle hair and nails. Skin with a yellow cast, not jaundice per se. But have you ever seen anybody that eats like a lot of cantaloupe or carrots? They get like that yellow orange hue on their skin. It may look like that, and I'm not sure what causes that. Weakness of bones and muscles. Luongo, that is baby fine hair, and it's all over their body to keep them warm. Low electrolytes, potassium, sodium, calcium, magnesium, and this could result in death, right? So you have to watch those. Hypoglycemia and neutropenia, so they're going to be at risk for infection. Recognizing cues of bulimia nervosa. So B is for binge eating. They binge and then they have uncontrolled eating followed by guilt and shame, and this is why they purge. So laxative abuse is another way to purge, or inducing vomiting is another way to purge, and that causes a whole host of systems we're going to talk about. M is for mood swings. They get very irritable due to their distorted body image and eating habits. They ruminate on it. And then I is imbalance for electrolytes like low potassium, especially from vomiting. And A is for absence of control over food intake. They feel powerless to stop. Clients with bulimia nervosa have normal weight usually. They have chipmunk cheeks because a parotid gland edema or swelling of the parotid gland due to inducing vomiting. They have dental caries, and this could happen later in life too if they had like bulimia as a teen, because the gastric acid erodes the teeth. But also when they're binging, they could eat a lot of sweets and not take good care of their teeth. Russell sign refers to calluses and also maybe like cuts on the knuckles due to vomiting, it's self-induced vomiting, and then dehydration from both purging and diuretic use are another cues to look for. The client with an eating disorder can be treated inpatient or outpatient. In either event, you collaborate with the dietitian. They will make the meal plan and they will titrate up the calories, and they usually start at 1,800 calories. Clients, on the other hand, need to eat everything on their plate, and the meals need to be given at specific times. You're going to need to watch for smearing or hiding of food, and we need to prevent refeeding. That's why everything is, they need to eat everything and it needs to be given at a special time. So refeeding syndrome is a condition that involves a fatal shift in fluid and electrolytes when somebody starts eating again. And they can have cardiovascular decompensation, elevated blood pressure, fatigue, muscle weakness. Vital signs need to be monitored during the refeeding time. And we also need to monitor the weight and their labs during this time. And for somebody with bulimia nervosa, you need to stay with the client after they eat up to an hour so they don't purge. Like most daily weights, they need to be done at the same time every day, before breakfast and in the AM after they void, on a stand-up scale. They can only wear a hospital gown, and the gown should not have pockets. And they may be able to wear underwear, but nothing else. And this is strategic, so clients don't try to put weights on their clothes to get a higher weight when they're being weighed. Also, lock the bathroom door after eating for up to an hour so that clients cannot purge after they eat. Psychosocial interventions that a patient with a eating disorder can undergo include cognitive behavioral therapy, which involves reframing dysfunctional thinking so that it addresses the distorted body image the patient has of themselves. And then the other one is dialectical behavioral therapy, which provides validation for their feelings, and this is also good therapy for people with borderline disorder. And sometimes borderline disorder and eating disorders coexist. So this might be an effective therapy. And then behavioral therapy, which works on the framework of reward. Okay, so like say the patient gains a little weight, they may be able to get, if they're inpatient, like a special activity they may be able to do. So they're rewarded for their behavioral actions.